The most pressing matter that I have heard from the constituency of Prince George North Caribou arises from our failed healthcare system. The speech from the throne reads, quote, providing life-saving care for everyone without taking out a credit card, unquote. That comment simply does not reflect the reality that people are facing, Mr. Speaker. My constituents who are travelling out of British Columbia to get life-saving treatments are being forced to choose between their health or their credit cards. That situation is unacceptable when they have already paid taxes in British Columbia for a system that continues to fail them. My office has heard from many people worried for themselves and their loved ones about either keeping the doctor they have or waiting an indeterminate amount of time to acquire a family doctor. The other issue is the excessive delays obtaining diagnostic services and treatment. It is especially concerning for the elderly and the most vulnerable, and those affected by life-threatening conditions. Mr. Speaker, I have heard from doctors looking to leave British Columbia because they cannot provide the services their patients need. Many are overworked and stressed. Some are unable to be in reliable contact with their families. I have encountered nurses who are leaving the profession due to overwork, ill treatment, and even violence in their work environments. I have constituents who are opting to travel to Mexico, the United States, and other countries and provinces to get the health care they need, and often at considerable cost. Mr. Speaker, this is Canada. This is British Columbia. Our constituents should not have to resort to such measures to ensure their well-being. Recruiting doctors from other countries is in effect a brain drain that removes the best and brightest from those places and thus serves to make a provincial problem a global one. Key to this uncertainty in our healthcare system is the struggle to train, recruit, and retain healthcare workers. Mr. Speaker, despite the valiant efforts of local governments, including a joint initiative between the City of Quesnel and the Caribou-Chilcotin Regional Hospital District Board, communities are in competition with each other to attract a limited number of health-related professionals. The Throne's speech states, quote, your government is responding by adding more nurses and family doctors, opening more community clinics and building more hospitals than ever, unquote. This ambitious claim belies the reality that medical professionals are moving away and some are even leaving their professions. The vaccine mandates of the COVID era forced out many healthcare professionals, some who have long since left for greener pastures elsewhere or changed their professions, never to return. To that end, I look forward to the conclusion of the series of ongoing reviews, including by the Office of the Merit Commissioner, who I had the pleasure of meeting with in Victoria last week. It's time to make these people whole. Perhaps the House could consider including municipal workers in the mandate of the Office of the Merit Commissioner to review municipal worker terminations during the COVID period. Mr. Speaker, how are people in Williams Lake and surrounding area, which includes many of my southern constituents, supposed to process such empty rhetoric when just the past Family Day weekend, again, the emergency room at Caribou Memorial Hospital in Williams Lake closed its doors to the public? Promises of access to more healthcare professionals ring hollow in the face of closed emergency departments. You had better believe for the constituents of Quesnel, Williams Lake, and across the rural parts of northern and interior health in my riding, they are not experiencing what the Throne speech claimed, quote, in the past 2 years, British Columbia has connected hundreds of thousands of people to a primary care provider. More are being connected every day, unquote. Is it just one for hundreds of thousands? It sure feels like it in many communities.